Good afternoon. Thank you for joining us here today. My name is Latasha Bird with Family Network on Disabilities Family STAR program. The STAR stands for Support, Training, Assistance, and Resources. We are the Family to Family Health Information Center here in the state of Florida, and our program assists families of children and youth with special health care needs and help their families to make informed decisions about their health care. We provide families with goals to be effective partners in healthcare in this decision-making process at all levels. And it is one of the honors to be able to help families with those services and resources and help them also successfully transition to all aspects of even adult healthcare, work, relations, and ultimately independence. So today you will be here for the first in a series of 3 workshops on parents as leaders. Today's workshop, number 1 in the series, will be on starting support groups. So let's go ahead and get into it. I want you to think in terms of how you would understand the information and take it and apply it to your own family's current situations. And should you need to receive any resources, please reach out to us and we will make sure that we have those resources available for you at the conclusion of today's presentation. So let's go ahead and get started. We're here today for Parents as Leaders, and this again is the first in a series of 3 workshops. The first will be on how to start a support group. We want to say thank you and welcome. We're glad that you stopped by to find a little bit more information about us here at Family Network on Disabilities. We are a family-driven and family-centered nonprofit 501c3 here in the state of Florida. One of the things that makes us really unique is that the majority of our board of directors, our program staff, myself included, the management, field staff, we're all family members, persons with disabilities themselves. We bring our learned and shared experiences to the table, especially with all of the resources that are encompassed in the workshops and presentations that we give. Now, we want to make one distinct clarification before we start, is that we do not act as formal attorneys or doctors or even mental health professionals. So the information that you receive in these workshops cannot be deemed as legal or medical advice. We do not interpret the law. However, what we do is to provide information and resources and support to families so that you can make informed decisions about your loved ones with disabilities. So again, thank you and welcome on behalf of our regional PTIs and the Family STAR program for those children with complex medical needs. Let's go ahead and get started. We're talking today about being a part of a support group. What does it take to start a support group? We'll think about these key bullet points as we matriculate through the presentation. Why start a support group? What does the structure look like? How would you have it formed? What type of engagement would you have for families and participants? And then finally, we'll touch on diversity and a culture within that group. So let's start at the top. Why start a group? Well, there are many different reasons why you may. There are parents that may recall what they felt like having to receive that initial diagnosis to say that your child was going to have a disability. And as individuals who provide support to families, and such as ourselves being parents as well, we've experienced the same types of things. We know what those overwhelming feelings would look like. So we would ask to figure out what are some of the emotions that you would have felt. Would it be fear, shock, denial, depression, maybe even anger in some instances? Were you disappointed? Did you feel devastated or embarrassed to an extent? Or perhaps even you might have even felt hopeless. but of any of those experiences, whatever they may have been. Loneliness is the one emotion that's constantly persistent in any of those exchanges that we have with families. We hear about being lonely. We hear about them perhaps being angry one day and sad the next, and all the while feeling so alone in that diagnosis bubble, if you will. Your immediate instinct as a parent is to become informed and starting that quest for information. But more than anything, you would need to know that there are others. You're not alone. There are others in that same situation. So support groups are the only things that will provide a sense of comfort for families and other individuals with disabilities. They provide a sense of kinship, if you will, a place that is safe to learn, a place that is safe to help others and have those different opportunities for interaction. They help build on those important social connections. And parents can educate themselves, but also support others in the same instance by gaining a stronger sense of community. And by doing so, you identify what the best practices are for your family, for schools, and even for the community. So when you're thinking in terms of still, but why should I start a support group? Well, you have questions. As parents, we have plenty of questions. Our children did not come with the manual. When you're planning for an improved life outcome for your child and for your family, and maybe have those new parenting skills around the behaviors that your child would have, this is a great way to be able to gain those skills and have your questions answered. You can also learn how to become an effective advocate, especially in the realm of education and healthcare outcomes as well, and even working in some instances on policy and systems of change. And then ultimately, you have some time to yourself. It seems kind of counterintuitive to say, well, I'm part of a group. How is that me time? But it is a form of self-care in that you are able to find that sense of community with others. So here are a couple of things that we want to consider. And what does the group look like? What will your membership look like? Their characteristics of a disability, to share information, to identify programs and different strategies, and also have professional organization as well. So let's talk about what it looks like in the beginning. So in the beginning, membership is often a few parents, maybe one or two, or a few more, unless there's some burning issue which impacts the number of children and families. For example, maybe there might be a change that's proposed in delivery of services within a school district. So when you're organized around that hot topic issue, generally the group may stay together to be able to change that policy or affect some type of change within that deliverable, or resolve the issue and then perhaps disband. Or the group may find common areas to continue having that time together. Membership is often, very fluid, and it depends on the needs of the family in relation to the objectives of the group. But typically, support and education are one of the main types of objectives for forming parent support groups. They can be formed around one specific disorder, such as autism spectrum disorder or ADHD, or more generalized topics such as just learning differences. Some groups develop a list of objectives for their group. I'll give you a couple of examples. They could maybe learn about characteristics of people with that same identified disability or difficulty, or even that same disorder. They can also share information that help members of the group by identifying programs, identifying different types of strategies and opportunities for people with that particular disability or disorder. And then often there's an information sharing that goes along as well, but being able to identify information that is relevant, such as books or other professional organizations which provide resources around that same disability or disorder. And this is one of the ways that membership can be affected in that sense. So let's talk about having a disability specific or an open forum. You see here, they make a name for the group, mission and goals, which is the sole purpose of the support group or that task force or a specific task with which the group is charged with assessing. So the goals would be activities or results that the group will work towards, so, such as developing the mission statement that can be created by the group. Then that goes on to having different types of roles by the members that would be involved in the group, and also a schedule. How often will you meet? How often will you go out into the community? Will you do it virtually? Will you meet in person? All of those different things will come into play with the specific meeting schedule. So then you want to establish some rules and guidelines, and they're just basically simple ways to make sure that everyone feels open, they feel comfortable in contributing information, speaking up during those meetings, and that decisions are made in the best interest of the organization. And all those who attend are treated respectfully and treated as true team members who are essential to the decision-making process. So establishing those meeting guidelines and ground rules in the very beginning will lay a framework for a positive personal interaction and better group making decisions. So think in terms of some of the groups and meetings that you've participated in, especially over the last 2 years. A lot of our meetings have been virtual. Did you feel like you were a valuable member of that team? Was the conversation dominated by just a few people, or did everyone have a chance to contribute and participate in either activities or round robin discussions or anything that would concern information sharing? Were you asked for ideas specifically, or better yet, were your ideas even considered if you offered them, and were they thoroughly discussed? See, these are things that you want to think about, especially at the beginning, to lay that perfect groundwork that you would follow within having your support group come into reality. I think in terms of these bullet points that are here right on the screen: confidentiality, advice, responsibility, acceptance. How do you deal with interruptions, attention, sharing questions, awareness, discussions, and finally, punctuality. You want to think about everything that's being shared in your group, not leaving the room. The group needs to develop a trust in order to smoothly and effectively continue and make sure that you are establishing the task at hand and staying on task as well, but not giving advice. If you're there to share feelings and experiences, but that's not an opportunity to just share unsolicited advice, except in a problem solving exercise. You want to have all members to share in the responsibility to make the group work and accept members just as they are. Really want to have one speaker at a time. Avoid interruptions if you can, sharing those experiences and giving equal attention to the members in that support group. Some people are just there to just receive the energy from the group. So having supportive attention to the person that is speaking, or to the person who is of the main focus at that point, would be a way to still foster the support that that person would need without them having to speak, meeting the group members where they are. You want to be in the present, being aware of their own feelings and helping to talk about what is present now rather than what life was like in the past, unless that is the topic at hand. making sure that the discussion stays on topic and not discuss group members who are not there, and beginning and ending on time. Remember, we want to try to stay on task. And those are one of the great ways that that support groups are able to move and flow effectively, with establishing those ground rules and guidelines from the very beginning. And thinking in terms of family engagement, this may alternate between parent support and parent engagement, or include both support and education during each meeting. You want to try to uh, make an event and take an event. So this is one of the ways that you want to figure what kind of format you will use, and how will you make discussions? Will they all be open forums where people are able to speak freely, or will you have something that's a little bit more structured? You can have the speaker or discussion formats as well, with the guest speaker and time for parents to ask questions and discuss any issues that they may have, and often share strategies, being effective in a goal setting, and a more focused and a formally oriented type of discussion for groups. Maybe invite a person with a disability, such as the members who are caregivers in the group who are taken care of. So this gives a great perspective. Other than just the parents, they can have someone that comes in, they're being the speaker. There are just several different ways that you can provide engagement and promote uh, that great discussion, to promote those formats that are giving parents a time to speak up and to be heard and get their questions asked, even if they are not so active, but they still want to receive the support from the group. You can also host a book or video or webinar presentation, sharing community resources, or having community fairs as well, and even coming together for an annual fundraiser. So these are all great resources that you can have. And if you think of others, add to that list. They can be very valuable for members and help to promote that active engagement with parents, and to apply all of the things that they learn by engaging actively within all of these things that are enumerated here in the list. And then if you think of more, adding those as well, trying them in different portions of the group, trying different things, and assessing what their effectiveness are, and then finally making adaptations that will work for the family. If you have no engagement, the group has less effectiveness. So we want to make sure that you share your information in a different format, share your information in lots of different ways, so that you can foster that open communication and keep things interesting. These are great ways for engagement. Can also have a facilitator, such as myself. Today, I am your facilitator and speaking on how to start support groups. Your facilitator is the person who leads, they inspire, they motivate their members, they conduct those, help to guide the discussions and conduct that meeting. And they try to have stimulating dialogues, and even may have advocacy training if that is the main focus of the group. They guide the members into remaining on track and keeping with the group's mission, helping them to reach their goals, and even helping them to produce attainable goal outcomes. And finally, just engaging with that group, helping the members to participate effectively and equally in group activities, helping to foster community and curiosity about the information that is shared, and even some excitement around what the next group meeting will entail. It also would help members to become great active listeners as well. So these are some of the qualities that you would have in a great facilitator. You want to think in terms of marketing a social network also as a way to form effective groups. Thinking of it this way: how many emails do you get from newsletters that you have signed up for, subscriptions that you have, uh, social media and other types of groups that you are a part of. These are all the same thing. And even though they might not be physical, being a part of a community is just as viable if it's on the other side of the screen. Thinking of it this way, are you on email lists? Do you have different types of social media accounts? Have you signed up for groups within those social media accounts? Do you have school calendars or school events that you are a part of? Parent organizations, even grandparent organizations, websites, publications, and even those different types of media such as radio and television, posted bulletin boards, though we don't see those as often, these are still great ways to find ways to meet up. A lot of those have been exchanged for video representations of those things that we previously held accounts of with paper, such as newspaper and bulletin boards and public meeting places and that type of thing. And then with the advent of social media, we have all of these different ways of networking via screens with Facebook and Twitter, Yahoo groups, Dropbox, Google Drives, meetups, and YouTube. So these are all ways to start support groups. They don't have to be physical. They can sometimes be virtual. And you can also have a hybrid of the two. So we talk about the ways to start in the beginning. Now let's add in a few details. First, you want to determine the date, the time, the place that the meetings will occur, what works, what doesn't work. Thinking in terms of an agenda, thinking of what are one or two main ideas or techniques or the different types of issues that you want to present that seem particularly helpful for you and your family, and would they work for your group as well? What subjects were covered that you would like to cover in a future meeting? These can all be added to the agenda, and then take notes to make sure that you captured all of the essence of the things that you spoke on. You want to prepare in advance and define what the structure of your meeting is going to look like, and survey what the group needs are, especially when getting ready to prepare for those notes. You want to think in terms of respectability, respecting all of those group members, with speaking with confidence and providing a safe and secure environment for them to be themselves, maintaining the purpose of the meeting, staying on task, and extinguishing those bad actors should you have those in your group, allowing others to lead as well, and being just sincere and honest. These are great ways to foster community and make sure that each member has a way to be heard. We don't want to be late or miss meetings or appear that we're disorganized or judgmental or even opinionated while going through the agenda for the meeting, or downplaying others' ideas or making personal agendas the focus of the group, or in telling inappropriate or offensive stories as well. You want to take an attendance sheet, make sure that you record the people that are in attendance of the group, and make sure that all of those decisions and plans and actions have been recorded effectively so that you can recapture at a later date those things that were discussed in the group. We want to give an homage to diversity and culture as well. We want to make sure that families in the community, families in your group, do not feel alienated just because of their background, or maybe the way that they speak, or the way that they are able to attend. We want to attend to all of those subject matters and make sure that the focus is on the issue at hand for the community, for the group, and not on a specific person. There may be families in your community who are not fluent in English, or families who lack those ordinary means of support simply due to some type of language barrier or cultural difference, or they may not be comfortable in a group that speaks only English. This is one of the ways we want to think in terms of how can we embrace diversity and embrace culture when we are surrounding people of different backgrounds, different areas, different all different experiences, but all coming together for one common goal, which may be for their loved ones with disabilities. One-on-one friendship can be helpful in terms of emotional support and having that person that you feel comfortable with attend group meetings with you. And they may be interested in even forming a parallel group that's facilitated in a language that they feel comfortable. And it may be beneficial for every person involved to arrange occasionally for either translator to be there or translate written materials such as the presentations and the meeting notes and the agendas that are available. They end up both that way, both groups can share ideas and concerns and get to know each other and understand all of those subtle nuances of the issues that are being discussed in each group and attend when special speakers are invited to each one of the meetings. But what we are really wanting to do is to understand what diversity looks like, to understand what other cultures look like, because the commonality is the loved one with the disability. So with that, we want to say thank you again for joining us here for part one in a series of 3 workshops on parents as leaders. Should you need more information, please reach out to us with either of our 3 regional PTIs and the Family Star program through our social media channels and also with our website at www.fndusa.org. And with that, we want to say again, thank you on behalf of Family Network on Disabilities. Should you need to contact us, you can do so at 1-800-825-5736. Again, that number is 1-800-825-5736. It is our pleasure to come to you, to bring you the information and support and resources that you may need for your family and for your loved one with disabilities. If you have any further questions, please use the information we have provided in this presentation to contact us so that we may further assist you with your endeavors. Thank you so much. We'll see you again for part 2 in our 3-part series. Bye, everybody.